Hi, welcome back to Meet Your Body. And today I am giving you my 1 year mastectomy update. And it's actually been, I'm looking at the calendar, it's been a year and almost 2 months, but I think that's close enough. I think the day came and went, and I definitely recognized it. And then I think I was just not wanting to talk about it. And here I am ready to talk about it. So it's actually been a year and about 2 months since I had a double mastectomy. So I will tell you, if you aren't aware of my history, I will definitely tell you my history. But keep in mind, I have quite a few podcast episodes and YouTube videos and resources around my story. So if there are questions that you have that I don't cover today, I will have the link to my free breast cancer resource guide on my website. And that has a lot of the links. So I have like a full Q&A of questions. A lot of people wrote in. So I have a full Q&A. I have a full episode about how I was diagnosed, all of that stuff. I have some workouts and things about cording. So I have a full resource guide. I will have the link for you there, but I will review kind of my story and tell you how I'm doing a year after my double mastectomy. And then also I'm going to talk about fat grafting because I had a second surgery. So kind of like a revision. I had a fat grafting procedure done right about at the year mark. And so I will explain that too, because I know I've had a lot of questions about that from people who are considering having it done. So I want to get into details around that. So my history, if you aren't sure, in late 2023, is that right? Yes. Late 2023, I had a mammogram. I was 46 years old and just having my regular mammograms done. And mine came back dense breast tissue. I knew that from years ago. I have no health history when it comes to breast cancer, no family history when it comes to breast cancer, I should say. So, no history of breast cancer whatsoever, or endometrial cancer or ovarian cancer in my family. I knew I had dense breast tissue. So, had a mammogram. It came back abnormal. Follow-up imaging came back abnormal. They did a biopsy, and I was diagnosed with what's called DCIS. It's ductal carcinoma in situ. So I never felt any lump. I had no symptoms whatsoever. This was caught on mammogram. With my specific situation, it was so widespread in my breast that a lumpectomy was not an option. And I would not, this is just my personal choice, my personal story. I most likely would not have chosen that anyway. I would have chosen a mastectomy, but in my case, I didn't have the choice. So my only choice was to have one breast or two, and I chose two. So I had a double mastectomy and I had reconstruction done. So I had implants at the same time, same surgery. So I had one surgery where they removed the breasts and put in the implants and had the reconstruction. And that was about 6 weeks after I was diagnosed. So it all happened very fast. My lymph nodes came back clear. So I did have a sentinel lymph node biopsy that came back clear. I was extremely lucky that it was caught early, extremely lucky my lymph nodes were clear. And so because of the choice of double mastectomy and the lymph nodes being clear, it had not spread. My follow-up was just that. It was follow-up. So I had no medication, no radiation, no chemotherapy. So even now, a year out, I still have follow-ups. I actually this week have ultrasound imaging because each one of my follow-up visits, they have felt a few lumps, and that has ended up being scar tissue. This is very common, so I should back up and get into that. But just so you know, my history is about 14 months ago, I had double mastectomy, and my continuation is follow up. So I see my oncologist, I see my breast surgeon, I see my plastic surgeon, all for very regular follow ups, including this week when I have one. So I will cover that piece first because that piece was something I wasn't really aware of. So at about maybe 4 months after my surgery, 4 to 6 months, somewhere in there, I saw my oncologist, and she showed me how to do a self breast exam. So even with a mastectomy, they take just about every scrap of breast tissue that they can. I mean, the only thing that's left is skin and or nipples, depending again on your situation, if you're able to keep your nipples or not. And so you have very, very little, if any, breast tissue left. There are always going to be a few cells that they don't get. Like that's basically it. It's almost 100%, but there's always going to be a few cells. And so you continue to do breast exams just to look for anything that might be out of the ordinary. And so she was showing me how to do one. She felt something that she didn't love, but she was very clear that she's like, I am very much not worried about this, but we follow up on everything now. In your case, someone who has been diagnosed with breast cancer, we will follow up with everything. So you're going to have an ultrasound done today. So I went back to the mammogram center. I don't get mammograms now. I had an ultrasound. It came back clear, but the same thing happened a month later, seeing my surgeon. They felt a little something in a different area. Immediate ultrasound that day, came back fine, but now I will have multiple follow-up ultrasounds. Again, it's mostly scar tissue, and then also some necrosis, so meaning some cells in some areas that have died and they're forming hard little balls. I can barely feel them. I can a little bit. And so that will, for me, continue to happen. So I just want to reiterate that all of this is my story. I mean, I am just here talking to you like if we were having coffee together. Literally, I'm coming from that perspective. I am a physical therapist. I'm a women's health expert. I have that knowledge. So what I give you comes from that lens because that's who I am. But I'm also just a woman with 2 young kids and a family who was very, very suddenly diagnosed with breast cancer. So I'm coming at it from both of those places. But just know everything I say is my story, my situation. It might apply to yours, it might not. And so that's where I am again with follow-ups, that I'll continue to have ultrasounds if we find any kind of little lumps or bumps, because it's just serious follow-up. But I personally did not have any of the other things that can happen after cancer. So I really tell people I have the story that I tell is about my healing from a mastectomy and the surgery and a little bit of the mental piece. I can't say that I understand whatsoever what it's like to have chemotherapy, to have radiation. I highly recommend you find people, if that is a part of your story, I highly recommend that you also have people in your sphere who you can walk with and talk to and who have walked that path before you, because I think it is a very important thing. If there's anything that I've learned from this journey, it is the importance of women carrying other women during this time. And so you might have a team of 1, you might have a team of 10 people just hopefully to carry you and hold you. And it can be women you've never met before, but people who have walked it before you that can give you a little bit of an expectation, like what might be coming, what can I expect, those kind of things. That was really helpful and important to me. So again, I reiterate that this is coming from a place of bilateral mastectomy and recovery from that. Yes, I was diagnosed with cancer, and I was told by my oncologist with pathology and everything that came after that basically when I woke up from my mastectomy, I no longer had cancer. I was dealing with all of the issues from the surgery afterwards. So that's the story that I'm coming from. So as I've talked about a little bit, I did have cording also, and I will go into more details on these on the other videos, but I did have cording. It's pretty significant cording that can happen after a sentinel lymph node biopsy. So I experienced that. So to kind of give you a timeline of it, my cording was significantly better around 6 months. And now I just feel it here and there. So skipping forward, where am I now? Let's talk about like physically, where am I now? Exercise, mentally. I told you a little bit about the follow-ups, so you kind of understand what you can possibly expect. And I've been told that like really regular follow-ups will last about 5 years. And after that, they might decrease. I don't think they ever go away. but they'll decrease a little bit. So physically, how am I doing? Like I said, the cording significantly went away at 6 months. So that I just feel a teeny bit here and there. If I lift really heavy weights or I'm really active with my arm, occasionally I'll feel it, but I mean, it is almost 100% resolved. I will always need to be aware of that arm. For example, I had to have an IV for my last surgery, and they asked which arm I wanted it in. They have to do the right because I had the sentinel lymph node biopsy in the left. So I will always have to be aware of that. That's something to keep in mind. Ask your doctor about. You'll just always want to be aware of the lymph system and the slight amount of damage that it sustained for the lymph node biopsy. So physically, and I guess you can see me if you're watching this. I have full range of motion in my arm. So it was my left arm that I had the cording. So that one feels a little bit tighter, but I have full range of motion in both of my arms. I don't feel limited in any of my day-to-day activities. I had physical therapy with a breast cancer rehab specialist, which I highly recommend afterwards, after my surgery. And again, being a physical therapist, and this is my job, and I have a significant health history that I've had to recover from a lot of surgeries before. I knew that my rehab was going to be a full-time job, and I took it that way. I really did. You need to be consistent with your motion and with your exercises and following your precautions and following your restrictions. But there is no reason, unless you have complications of your surgery, that tell you that there's no reason you can't get back to your full range of motion. Now, do I feel the same? No, I don't. And that's just a good difference to kind of understand that even though I have this is full range of motion, I don't need more than that, but it feels tight. It feels different than it did before. And I think it just always will. I don't know if it's the mastectomy piece or the implant piece or both, but it doesn't quite feel the same as it did before. I'm still not comfortable laying on my stomach. Luckily, I never slept on my stomach. That's not an issue. But I teach Pilates. I am down on my stomach sometimes, and it doesn't feel fully comfortable. I haven't gotten a massage since my surgery because I know I could, but I kind of feel like I need to prop myself quite a bit to lay on my stomach. So that's just one thing for me. I'm still not really comfortable laying on my stomach. So I don't feel the same as I did, but range of motion and my daily activities, I feel 100% back. I am not 100% back to my exercise. And I will clarify it saying this. I feel comfortable trying anything and getting into any position. I do not have full strength for push-ups, which again, I was never really strong with push-ups. But I was able to do 10 strong push-ups on my toes, and I still cannot do that. I can do them on my knees. So I really need to work towards that. I am not as comfortable with push-ups and pull-ups, which same. I was never able to do a full pull-up, but I was really working on them and really working to do them on the pull-up machine. And that is coming back. But those are where I feel the most either disconnect with kind of the muscles that were injured or weakness, not pain, just the only way I can really explain it is weakness, yes, but also a disconnect. So that kind of explains physically where I am, and I will keep working on it. I've worked on my grip strength quite a bit because my grip strength was very weak after surgery. So I've been working on grip strength. Again, the pull-up motion, just long arm hangs, push-ups, those kind of things. I can do a handstand again. But I don't feel completely connected to that part of my body. And I'm wondering if that will ever be the case. I don't know. Each of my other surgeries, it's come back faster, the connection, and this, it just feels different. And I don't know exactly why. I think I'd have to do a deep dive into myself to kind of figure out why, but I just can say I don't feel completely connected to that part of my body, whether it's the mastectomy or the implant. I mean, I think it's both. It's all the same to me. It's all wrapped up into one surgery. But it doesn't quite feel like mine. And that's okay. That's okay. It's just something I am aware of. And so that is one thing I can say is it's a lot better than it was. And it has only been a year. I think it takes time. So let's talk about the feeling, like literal feeling, because when you have a mastectomy, nerves are cut, you will be numb forever. You basically lose feeling forever in your breasts, your chest area, like your breast area. There are options to have nerve sparing or nerve grafting surgery. It is fairly new. It's not always covered by insurance, and it's not offered by every doctor. I did have the nerve grafting procedure done. My doctor is very good at it. She knows how to do it. She offers it. My insurance did not cover it. So we had a big discussion about price beforehand. And I felt like given very clear expectations that about 80% of the time you will get some feeling back. I was not given a guarantee, but about 80% of the time you will get some feeling back with nerve grafting at the point that I had the surgery done. So that was worth it to me. Again, it's risk reward. You have to decide it was worth it to me. So I have some feeling, but I do want to clarify. Well, let me say this. It can take two years easily for nerves to heal and regenerate. So I am not there yet. Very much not there. My doctor still feels very positive about what's happening in that area and the feeling that I have. So I will continue to get more feeling up until the 2-year point. I do have feeling, but it does not feel like it did beforehand. And that too, I do not expect it to at this point. I am happy to have some feeling. But sometimes it's not the best feeling either as nerves regenerate. I mean, I still get kind of the little lightning strike feelings sometimes, and I'll get an itch. Like just yesterday, I had this itch, but I can't feel when I'm itching it. So it's like this internal itch that I can't get to. That's part of nerve healing. I think being a physical therapist really helped me with my expectations because I understand how nerves, I had a lot of pain, and that can be with nerve grafting or without. I had a lot of paresthesia, a lot of hyperesthesia after surgery that caused me a lot of pain. I was on gabapentin for a while. Thank goodness all of that resolved. Again, I do not think that's because of the nerve grafting. I think that was just part of the surgery. And so I understood what it can mean for nerves to heal, symptoms that you can have, and also how to deal with it. There's quite a few physical therapy techniques that I was doing to help with my sensitization, and I'm still doing them now. But I really like to point that out because not everyone knows that nerve grafting is a possibility. Ask your surgeon about it. I am very glad I did it because I would have regretted not doing it. And also, it's not a magic bullet. Like, it is not a for sure thing. You might get some of your feeling back. You might get all of it. Again, it might feel different. Mine is all over the place. I have some pockets of being fairly numb. I have some pockets that feel totally normal. I have some that just kind of feel like, I still don't want to touch it. It's uncomfortable. I have all of that still, which is probably a big part of that feeling of disconnect from that area. So that is the feeling part. I've covered the exercise part and the strength part, and the follow-up part. Mentally, I think we are all different. I mean, I just keep going back to I am one of the lucky ones. I am 100% one of the lucky ones to have had a diagnosis that had a clear clinical route, that I do not have cancer in my body right now, that I didn't need the follow-up treatments. I mean, that's what I keep going back to. And also, I still have moments of it being hard. I still have moments of it being hard, like I said, where I just look at my body and say, gosh, that doesn't feel like mine. Just yesterday, I was reading about treatments for other things, like promising treatments about even HRT and those kind of things. And then, oh yeah, I am not saying I can't do it, but it adds more questions when you have a health history of cancer and breast cancer. It changes what your options are in other ways. Like, those are the kind of things that it almost comes up to surprise me sometimes. Oh, wow. Yeah, I had breast cancer. That will always be in my health history. Yeah, I will be making different choices based on that going forward. So it's still kind of that awareness. I think I'm still processing it, to be honest. But overall, physically, I am doing really well. And I want to give hope to people, just like I did when I had my hysterectomy. And I feel like we just aren't given a lot of general ideas of how we're going to do physically. And cancer is a whole different animal because it's done very quickly. You have to make choices very quickly. It's really scary. And if you do have follow-up treatments and chemotherapy, you are dealing with all of that. Like, that is priority one over getting your strength back and exercising, right? Like, that makes sense. And so sometimes that part of, I want to feel strong in my body and move my body again, I feel like sometimes that part is just put to the back burner. I mean, as it should be. Your health is what is most important during that time, but it's put to the back burner. And so I just want to be that person when you're ready to deal with the physical piece and the exercise piece and the strength piece of the mastectomy itself and having implants. Want to be that person to tell you, you got this. You will find your strength again. Yeah, it takes some work. Absolutely. And it takes dedication and finding a team around you and maybe doing some of your own research. It takes all that. But yes, like, you can find it. Absolutely. Give yourself lots of patience and lots of time and lots of grace. So that's where I am a year after mastectomy. So let's talk a little bit about the fat grafting procedure I had done. So this was something too I wasn't fully aware of when I first had the mastectomy. So that's why I like to bring it up, because it's not always talked about as an option that might come to pass later on. So this happens for people typically, again, everybody's different, but typically this is going to be an option for people who have a mastectomy and do have implants. Because what happens in that case, like typically if you have breast augmentation without a mastectomy, you aren't having anything removed. You are adding an implant of some way, shape, or form. You're adding an implant to your natural tissue. And without realizing it, your natural tissue, which includes a lot of fat and breast tissue, is used to help make that implant look really natural. Like, it's still rounded and supple and it looks like a natural breast. I know if there's an implant in there, yes, it can oftentimes look like there's an implant also, but you have that roundedness. It's meant to look like a breast. When you have a mastectomy, every bit of tissue is taken out except your skin. So you have skin and then like your muscles and your bones. All that fat and all that breast tissue is removed, as it should be. So when you then add an implant in, I'm talking so much with my hands for those of you watching versus just listening. I'm such a hand talker. So when you add that implant in and the skin on top of it, you have some natural rippling that happens on the implant, and you don't have any fat to round that out or take it away. So your skin sits right on top of it. And this is more common in people who are very petite. That's the statistics. It's going to be more common if you're petite. And so the skin sits right on top of it. And so what can happen, especially, and you'll notice it a few months later, I noticed it really around probably 4 or 5 months later, because the swelling goes down. You will start to see rippling in the breast itself because of that, because you are actually seeing the rippling that happens in the implant and your skin is laying right on top of it. And for me, it would happen if I was bending forward. Like if you kind of go concave and round forward, it literally looked like, the rippling was getting worse and looked like raisins. Now, I didn't know if I cared, to be honest, because you couldn't notice it whatsoever in any of my clothes, including bathing suits. I was in Hawaii, you couldn't tell whatsoever. Bathing suits, my workout clothes, bras, you could never notice it. My family didn't notice it unless I showed it to them. The only one who noticed was me. But here's the thing, I noticed it every time I had to change clothes, every time I took a shower, every time I put on lotion, constantly, every day. I noticed it. And it reminded me, it was a constant reminder that it wasn't my body, or that it was a different body than I had had. It was a constant reminder that I had cancer and had to have a mastectomy. And if you guys have followed me for a while, you know, like, I own my health history. I mean, I own this body. I'm a partner with this body. We've been through a lot. I have a lot of scars. I have a lot of procedures. A lot of things. And so typically aesthetics don't get to me like that. Not that I don't care whatsoever. It's more that, again, I've just had to walk through so many things with this body that I've gotten to a point that I'm just going to walk with it and just be so thankful for what I can do. So I was as surprised as anyone that aesthetically this was bothering me. But I think it really was more connected to being that constant reminder, just a constant reminder of what I had lost. I think that might be a little bit of what I felt with it. And that is common. Okay. This rippling is very common. You just have to decide if it bothers you or if it doesn't bother you. The procedure is common also, and it's called fat grafting. So what they will do to fix that, or to address it, it doesn't fix it. What they do to address it is basically liposuction. So they find somewhere on your body that they're going to take fat, and then they clean it up and put it through a machine, and then they inject it into your breasts, all around the breast where the rippling is, and that, so that it will make it more supple, like less rippling, more supple, more like a breast. And it, again, isn't 100%. Typically, like what I was told is if you long-term have 50%, that it retains 50%, that's a great number, because it is fat and your body will metabolize it over time. And that's different for everyone, like how much you exercise, if you lose weight, if you have weight to lose, your age, your metabolism, all of those things are dependent on it. But your body can and typically will metabolize some of that fat over time. So it's not a 100% permanent solution. But again, I was told if you can expect, or if you get about 50%, meaning you metabolize maybe 50% of it, but you retain 50%, that's a pretty good number. And I know people now that I've talked to women about this, I know women who've had multiple fat grafting procedures done over time. So I decided to go ahead and do it. And honestly, one of the biggest reasons was I just felt like I would regret not doing it. It wasn't that I 100% wanted to do it, but I tell everyone I talk to, are you ever 100% about surgery? Not usually. That's a tough sell to be 100% like, yes, I'm so excited to have surgery. I just really felt like I would regret it if I didn't try it. And then, I mean, to be totally honest, logically, like just from a perspective of insurance, we had reached our deductible because I had surgery in January. So I had my mastectomy in January, and I had my fat grafting in December because we had already met our deductible. I mean, that's just realistically, that was a little bit of a benefit to not have to pay my deductible again. I wouldn't have done it sooner. All right. So that's one thing I'll say. I try to tell my patients, wait a year between surgeries if you can. You do not always have that choice, but if you can, wait a year for your body to recover. So I was pretty close to a year. So I wasn't worried about that part. It was pretty close to a year. And so I had that procedure done. It was a much easier procedure than a mastectomy, but it was also still really hard because it's a major surgery. But it was easier than mastectomy. I didn't have drains or anything like that. I was sore in my breast for just about a week. That part was not a big deal. And I'm trying to remember, I was back to my compression bras, but only for about 2 weeks in my bras itself. And then I went back to regular bras. So they weren't too concerned about what was happening up in my breast. Like, I just needed to not do extreme exercise for 2 to 4 weeks. I still exercised, actually. So I just did gentle movement and walks. I didn't do anything extreme. So I was like, not to get the fat all moving around. But overall, the breasts themselves responded very well. I bounced back, at least feeling wise. I wasn't too sore. I only slept on my back for 1 to 2 weeks, and then I could sleep on my side again. I was very sore in my legs. So for me, they took the fat from my inner and outer legs. And I was warned by everyone, this is common knowledge if you have the surgery done, that wherever they take the fat grafting from will be so sore. It was so sore. And it is still, okay, I'm looking at my calendar again. January, February, March. 3 months. It's been 3 months. My legs are still sore to the touch if I touch them. Now, I can do the exercise I want to do, but to the touch, like light touch, especially shaving my legs, I still feel it. And so it's no joke. I have 8 little scars on my legs. Now, I was very concerned about like dimpling and scarring from the fat grafting sites. I was thinking, why do I want to cause possible scarring in my legs for something up in my breast that most people can't see? I didn't know about that trade-off, but I will tell you. And again, I worked on it. Okay. I did scar massage from the moment I was allowed to. I've done my red light. That has been a constant companion for me through this process. I have done a lot to work on them, and they are not a problem. They just look like almost little freckles. I mean, you can tell they're little scars, but I haven't had a dimpling problem personally. So just for anyone wondering, that has not been a problem for me, but I have, yes, 8, 2 little ones kind of down, like halfway down my thighs on my inner and outer, and then 2 little ones on my upper outer and 2 little ones right at my groin, all which can be seen even wearing a bikini. So if anyone is wondering about that. And then it did help the rippling. It did not solve all of the rippling. It helped probably, if I had to give a percentage, 60, 65%, but I still have some. I am glad I did it because I would have regretted not doing it, but I don't see myself doing it again necessarily. Like I wouldn't in the future, I would not go through that surgery again for what I believe would be just a little more benefit in the future. I'm not saying I wouldn't have done it. I'm glad I did it, but I wouldn't do a second one for that little bit of benefit. Now, there's one thing I want to throw out for anyone who is wondering about it. I've been told, and I haven't done my own research because I'm not ready for it yet, but in the future, if I decide I want to do a grafting procedure again, if the rippling gets worse or it's bothering me, I have been told by my doctor that there is a procedure that instead of using your own fat, they use a synthetic material and you don't have to go under anesthesia for it. So it's like just in the office, out of the office, where they use a synthetic material. So then it doesn't get metabolized, but it's also not covered by insurance because the fat grafting was, FYI, sorry, the fat grafting was covered by insurance. And this procedure wouldn't be. So that's intriguing to me. That is what, if I get to the point in the future that I want another fat grafting or another kind of procedure to help with the rippling, I would look into that. And I haven't done any research to be able to tell you more. Like, I don't know what the synthetic material is. I don't know what the long-term outcomes are. I don't know what the cost is. I don't know any of that. But that is what I would look into. I personally do not have an interest at this moment of going through that liposuction piece again because it was not fun. But I do want to reiterate, I do not regret doing it whatsoever. 1, because I knew I wanted to try it, and 2, because it did help. It did help. Absolutely. So I'm glad I did it. And I don't want to do it again. I don't. As of right now, I just don't. I just really want to settle into some time of not having more procedures done. That's where I am. And I think that covers all of it. I appreciate you all on this journey, especially those of you who've been with me on this journey from the beginning, from the moment I was diagnosed. And extra special thanks to many of you and members who have reached out because you've had the same journey and you walked it before me. And I really mean it when I say that is what I carry with me from this time, is the power of having women who have walked a journey before you share their stories, because that saved me and that carried me during this time. So that is what I'm so grateful for. And that's what I hope I can be just a little bit to anyone else out there. So like I said, I will have the links for all of those resources. If you have more questions, like I do in those previous podcast episodes, I talk about why I chose to do both instead of one, why I chose reconstruction and implants versus a DEI P flap, or versus no implants whatsoever. I talk about that because I know those are big questions. I can just tell you my personal choices, but I do cover all of that. So hopefully that helps. And then I also have a big podcast episode about how to prepare for surgery. And I think that's really important if you're going through any surgery. So definitely check those out. You have people with you. You are not alone. And thanks for coming to meet your body today. I'll talk to you soon.